respiratory illnesses hitting children hard this year.
Connecticut Children's Hospital is jammed, so is its emergency room. In the city, NYU Langone and New York Presbyterian are seeing an uptick. More children's respiratory cases than usual for this time of year.
All right, so a big reason why is a virus called RSV, and here to tell us about it is Dr. Arun Chopra. He is with NYU Langone. His expertise is pediatric critical care. So, doctor, thank you so much for being here this morning to talk about this.
Yeah, thanks for having me.
Yeah, this is certainly an important topic. I'm a parent of a 4-month-old, so I'm really worried about it because this is supposed to be really most prevalent in infants and toddlers, most dangerous, excuse me, for infants and toddlers. So what should parents be on the lookout for, and how should they handle it?
Yeah, so I think the first thing to say is we see this every year, an increase in RSV or respiratory syncytial virus. It usually starts a little bit later in the winter, and since last year we started to see it earlier. It's uptick even as early as March, but this year it's really started in September. Most children will get just a common cold, will be sick for a few days. Kids that are at highest risk, under a year of age, a history of lung disease, heart disease, and things like that. So usually kids will be sick for just a couple of days. We'll need, extra fluids and, fever control and things like that at home. Every once in a while, these kids get sicker. And this year we are seeing an increased rate of this virus and a lot of kids coming into the hospital.
So it's early again. There's another uptick. What's causing this?
Well, it's hard to say entirely. There are probably a lot of different things playing into it. I do think that the usual pattern of viral illnesses has been disrupted by the pandemic. We saw pretty much no RSV. Everybody was inside and social distanced. And so I think we're seeing a large susceptibility now in the population, and so RSV is running around and kids can get sick. Defense is going to be good hand washing.
And I've mentioned to a few people, RSV is on the rise, and some people say, what is it? So, and I'm a new parent, and I didn't know what it was. So what exactly is RSV?
So it's a virus that attacks the respiratory tract. It usually stays in the upper tract, so it gives you a cold. Runny nose can give you a fever, can give you a cough and sneeze. Every once in a while, it will get down into the lower bronchial and lung, and you can get either bronchiolitis or pneumonia. So that's sort of the range of things that you can get. And like I said, it is something we see every year. And most children don't get very sick, but children under 2 years of age are at higher risk, mostly because their lungs are smaller. And a lot of inflammation can make it harder for them to breathe.
Now, you had mentioned washing your hands if you're a parent to help minimize the spread. But is there anything else that we can do as parents to prevent RSV from reaching our kids?
Yeah, sure. I mean, I think this is something that's spread as we've all become very accustomed to by respiratory droplets. So when you sneeze or cough, you expel some of these viral particles. It can get onto things, get onto your hands, and then when you touch your face, you can inoculate yourself. That's why washing your hands really related. Social distancing will help decrease this, but like I said, for most children, they're not going to get very sick. If you have a child at risk, there is the opportunity for a treatment to stop you from getting infected, carcinogens, and if you are at risk, you are eligible for that.
Okay. And there is a test for RSV, right? That's a nasal swab or something like that?
Yeah, they do a nasal swab and that's fine. Yep.
Okay, so let me ask you this, because I was doing some reading about it, and it was saying to keep the young ones away from folks who have colds, which is obviously common sense, right? But can an adult have RSV and give it to the kid? If you have a runny nose yourself. So talk about the spread here.
Yeah, absolutely. So, I mean, we can all get RSV. So, I think the reason we're seeing a bigger spread this year is everybody is getting it and is spreading it. And so in older people, it really just causes a cold. And so someone who's got a cold, runny nose, fever, really shouldn't be around other people in general, whether it's RSV or any one of the other viruses. And so if you have a young child or a child who's specifically at risk, lung disease, heart disease, immune deficiency, you really shouldn't be around to visit your friends who have a young.
Yeah, well, there's an uptick now, but any idea of when this will start trending downward?
So
cases?
usually it's a couple of months is the usual time frame. It's a little hard for me to predict because the last couple of years have been unusual. The other thing we are watching, by the way, is flu, which hasn't started yet, but we're expecting that to be busy as well. So overall, for children's hospitals, we expect a very busy winter.
Yeah, and let me just squeeze this in. We're almost out of time here, but I was reading about children being put on ventilators because of it, and it sounds terrifying, right? So why is there, when you go to the hospital, what's the treatment?
So unfortunately, treatment for RSV and many of these other viruses is supportive. We can use ventilators, and that's something that I do in my work, but there's extra oxygen and respiratory treatments to really help mobilize some of the secretions out of the lung is usually all we need to do. So generally, we're able to support children with a lot less than a ventilator, but if needed, we can do that and have.
All right. Dr. Arun Chopra of NYU Langone, thanks so much for your information this morning. Very helpful.
Yeah, thanks for having me.
All right.
All right. Bye now.